Welcome to CPT Coding Guidelines Review, Wound Repair by Closure. Achieving accurate and complete coding is the purpose of coding guidelines. However, you can't take advantage of the benefit of having guidelines if you don't know what direction they provide. Even if you don't know the specifics of a guideline, just being aware that guidance is available for a particular situation is valuable. This series is designed to help you become better acquainted with often unfamiliar CPT guidelines for coding of significant procedures, with the intent of making you aware that the guidance exists to ultimately improve coding proficiency and boost confidence in your ability to code these procedures. The guidelines are waiting, so let's get started. Knowing something about the objective of a procedure and/or how the procedure is performed always promotes understanding of the direction given in the guidelines. This installment of CPT Coding Guidelines Review covers the guidelines for coding procedures to repair wounds by closure. So, before we dive into the guidelines themselves, let's take a quick look at what wound repair is. Wound repair by closure is surgical repair. This type of repair is accomplished via sutures, staples, adhesive strips, or surgical glue. This is also called repair by primary intention. This type of repair is used for clean wounds that can be closed within a few hours after they develop. Typically, the wounds being repaired are traumatic wounds such as lacerations or crush injuries. Surgical wound closure has several advantages, including less tissue loss, a lower risk of infection, minimal scarring, and faster healing. If you'd like more detailed information about wound closure procedures, including closure by primary, secondary, and tertiary intention, the reference shown here is a good option for an expanded overview of these procedures. Codes for repair by surgical closure come from the range of codes 12001 to 13160. These codes report wound closure using sutures, staples, or tissue adhesive. These codes are used whether a single method of repair is used or if a combination of these methods or these methods combined with adhesive strips is used for the repair. For example, a single code from this range is used for a repair accomplished by using both sutures and surgical glue, such as Dermabond, or staples and adhesive strips. Chemical or electrocauterization of wound edges and closure by adhesive strips alone are not reported separately. These procedures are included in evaluating and managing the patient. Therefore, the effort expended in performing these procedures is captured in the E&M code. In CPT, repair of wounds is classified to one of three types of repairs: simple, intermediate, or complex. Simple repairs are those used for superficial wounds that involve primarily the dermis, epidermis, or subcutaneous tissue without significant involvement of deeper structures. These repairs generally require only a simple, single-layer closure. Procedures performed to achieve hemostasis and administration of topic or local anesthetic are included in the work of the repair and are not coded separately. Intermediate repairs include wounds that, in addition to what is included in a simple repair, require layered closure of deeper layers of subcutaneous tissue and superficial fascia, meaning non-muscle fascia, in addition to closure of the skin, meaning the dermis and epidermis. Intermediate repairs include limited undermining. If a wound requires only single-layer closure, but is heavily contaminated and requires extensive cleansing and/or removal of particulate matter, this also qualifies as an intermediate repair. Limited undermining is defined as a distance less than the maximum width of the defect, as measured perpendicular to the closure line along at least one entire edge of the defect. Limited undermining is included in intermediate repair. Complex repairs are reported with codes from the range of 13100 to 13160 and include the work included in intermediate repairs. To be considered complex, a repair must include at least one of the following: exposure of bone, cartilage, tendon, or a named neurovascular structure, debridement of wound edges, extensive undermining, involvement of the helical rim, vermilion border, or nostril rim, or placement of retention sutures. Necessary preparation for a complex repair includes creating a limited defect for repair and debridement of complicated lacerations or avulsions, so these are not separately reportable. However, excision of benign or malignant lesions, excisional preparation of the wound bed, and debridement of an open fracture or dislocation are not considered necessary preparation, so these procedures may be reported separately with the appropriate CPT codes. Extensive undermining is defined as a distance greater than or equal to the maximum width of the defect as measured perpendicular to the closure line, along at least one entire edge of the defect. Remember that undermining with a distance less than the maximum width of the defect is limited undermining, which is included in intermediate repair as well as complex repair. For all wound closures, the repaired wound or wounds are measured and recorded in centimeters. When repairing multiple wounds, code selection is made based on the total length of repair. Total length of repair is calculated by adding together the lengths of repairs of the same classification, such as all simple repairs, for the same anatomic grouping as listed in the code descriptors. For example, simple repairs of the ears, nose, and lips would be added together because they are all repairs of the same classification, simple, and the ears, nose, and lips are all included in the same anatomic grouping found in codes 12011 to 12018. Repairs of wounds of different classifications or from different anatomic groupings are not added together. When more than one classification of wound is repaired during the same operative session, the more complicated repair is the primary procedure, and the less complicated repair is listed as a secondary procedure with modifier 59 appended. Examples of repair of multiple wounds where the length of repairs are added together include intermediate repair of the neck, right foot, and left hand, or complex repair of the forehead, left cheek, and chin. Examples of repair of multiple wounds where the length of repairs are not added together include simple repair of the right hand with intermediate repair of the right hand, because these are repairs of different classifications, and intermediate repair of the scalp with intermediate repair of the nose, because although these are repairs from the same classification, the site of the repairs are from different anatomic groups as outlined in the descriptors for codes for intermediate repair. It is important to note that anatomic groupings are not the same across repair classifications. For instance, the scalp and hand and feet are in the same anatomic group for simple repairs, but in different anatomic groups for intermediate repairs. It is important to review the sites in each anatomic group before making final code selection. Debridement is included in wound repair and not coded separately unless the wound is grossly contaminated and requires prolonged cleansing, appreciable amounts of devitalized or contaminated tissues are removed, or debridement is carried out separately without immediate primary closure. Extensive debridement associated with penetrating or blunt trauma or open fractures or dislocations is coded from the appropriate range of CPT codes from the codes for procedures on the integumentary system. Simple ligation of blood vessels in an open wound is included in closure of the wound. Simple exploration of nerves, blood vessels, and tendons is also included, unless an appreciable amount of dissection is required to accomplish the exploration. Repair of nerves, blood vessels, and tendons associated with an open wound is reported with a code from the appropriate body system. For instance, repair of nerves would be reported with a code from the nervous system subsection of the surgical section of CPT. Any repairs classified as simple or intermediate that are performed to close the wound are included in the primary procedure for repair of these other structures. If a complex repair is required to close the wound, the repair is separately reportable. Modifier 59 should be assigned to the code for the complex repair. If a wound requires enlargement, extension of dissection to determine penetration, debridement or removal of foreign body, or ligation or coagulation of minor subcutaneous or muscular blood vessels, assign codes 20100 to 20103, exploration of penetrating wound, as appropriate. Thanks for watching. Health Information Associates is committed to providing educational products that help coders to be their best. So be sure to check out the other presentations in the CPT Coding Guidelines Review series, as well as our full catalog of courses at hialearn.com.